Hello everyone. Today we'll be talking about intravenous anesthetics. Intravenous anesthetics are a group of fast-acting compounds that are used to induce a state of impaired awareness or complete sedation. Commonly used intravenous anesthetics include propofol, etomidate, ketamine, and barbiturates such as Thiopentol. That's the most commonly used antibarbiturates. So in this presentation, we'll focus on Thiopental, Propofol, Ketamine, and Etomidate. So this is a detailed presentation on the above drugs. However, if you're looking for a summary, I have created a summary video on IV anesthetics too. You can go through that as well. So Thiopental sodium. This is an ultra short acting barbiturate found as a yellowish powder with a bitter taste and a faint smell of garlic, so such as the sulfuric smell. It is used for induction of anesthesia, but it has no analgesic properties. Induction is generally smooth and rapid, but dose-related cardiovascular and respiratory depression can occur. So, as we're talking about, I'll try to emphasize on the main points. So, injection is smooth, but you may have rapid but dose-related cardiovascular and respiratory depression. Okay. Then another thing you need to take note is that it has no analgesic properties. Mechanism of action is due to the interaction with GABA receptors which enhance GABAergic transmission. There is potentiation of GABA action on chloride entry into the neurons by prolonging the duration of the chloride channel openings. In addition to this, there is also blockade of excitatory glutamate receptors. So let's talk about the dosage, onset of action, and duration. So Thiopentone is administered IV intravenous as a 1%, 2.5%, and 5% solution. However, recommended is 2.5% or less. Then the dosage is 3 to 6 milligrams per kg body weight. So in a healthy adult. So one thing you need to know is the reference for these dosages. I got them from Pocket Anesthesia Reference Guide. I have included the link at the end, so maybe you can go through it as well. Then one thing you need to know is elderly patients often require smaller doses than young adults. Onset of action is 30 to 60 seconds. This time has been referred to as the arm brain circulation time, which is basically the time required for the drug to pass from the site of injection to the brain as it passes through the right heart, pulmonary circulation, and left heart. Duration of action is 5 to 10 minutes. The patient awakes after this period of time not because the drug has been metabolized. Its half-life is about 5 to 12 hours. However, the reason is because the Thiopentone has moved away from the brain and is entering the more slowly perfused organs. Hence, the termination of action of the drug is due to its redistribution from the brain to other tissues and organs. Thiopental is highly lipid soluble and highly protein bound by albumin 75%, which prevents its precipitation out of solution in vivo. Sulfur-containing drugs, acidosis, and NSAIDs may displace the thiopental from albumin. This will lead to an increase in free thiopental, which increases the anesthetic potency and toxicity. So one thing you need to take note is if you're giving a patient thiopental, you need to ask what other drugs they're taking. Because what happens is NSAIDs are a very common group of drugs that a lot of people take, right? So what will happen is the NSAIDs are going to displace thiopental from albumin. So once that is displaced, it means that there's more thiopental in the blood to act, right? So due to which you may get a higher chance of toxicity. Liver and renal disease may be associated with low albumin levels, also raising free serum thiopental concentrations. The drug is metabolized by the liver. So if there is a liver problem, you need to know that you need to adjust the doses of thiopental. Because first of all, the albumin levels will be reduced, so there will be more thiopental present. And as well as if the metabolism occurs in the liver, if the liver is not functioning well, most likely the drug will be metabolized more slowly. So you need to really take care of the doses that you're giving. Central nervous system. Thiopentone decreases cerebral electrical and metabolic activity. It can also decrease elevated intracranial pressure. And the reason there is a decrease in intracranial pressure is as a result of cerebral vasoconstriction, reduced cerebral metabolism, and oxygen requirements. This is associated with a decrease in cerebral blood volume. The overall effect is an improvement of cerebral perfusion pressure. If you remember what was cerebral perfusion pressure, that's basically mean arterial pressure minus intracranial pressure. So if you're reducing the intracranial pressure, we are increasing the cerebral perfusion pressure, right? Thiopentone also decreases intraocular pressure up to 25% with 3 to 6 milligrams per kg dosage. The decrease in intraocular pressure persists for 3 to 5 minutes. And remember in the first slide that was talking about Thiopentone, we said that it has no analgesic properties. It actually has anti-analgesic properties. Why? Because if we give them low doses, we decrease a patient's pain threshold, so they might feel more pain actually. Cardiovascular system, this dose-related depression of myocardial function. So basically cardiac output, stroke volume, and blood pressure. Coronary blood flow, heart rate, and myocardial oxygen uptake all increase following administration of Thiopentone. Venous tone decreases, which is basically that leads to decreased preload and contributes to the increase in heart rate and decrease in blood pressure. There is little change to the total peripheral resistance. Respiratory system. Injection of anesthesia with Thiopentone may be associated with apnea. The duration of apnea following a sleep dose of Thiopentone is usually less than 1 minute. There is a dose-related depression of the respiratory response to hypercapnia and hypoxia. Laryngospasm may occur with induction, especially at light levels of anesthesia and with airway manipulation. So you need to take note is that you calculate the dosage properly because if there is light levels of anesthesia, you predispose the patient to developing laryngospasm. Bronchoconstriction may be associated with Thiopentone but is much more commonly seen following a small dose of Thiopentone with airway manipulation or intubation. As with any general anesthetic agent, the functional residual capacity is reduced with intubation with injection of anesthesia by up to 20%. Gastrointestinal enzyme injection may occur with prolonged high-dose therapy as in barbiturate-induced comas. Genitourinary pregnancy and fetus, Thiopentone has little or no effect on the kidneys or graviduretes, although Thiopentone rapidly crosses the placenta to reach the fetus. It has no significant effect on the fetus when used for cesarean section, provided the dose used is limited to 4 milligrams per kg. Remember, the normal dose is what 3 to 6. So if you're using it in cesarean section, you shouldn't exceed 4 milligrams per kg body weight. What are the indications of use of Thiopentone? Injection of anesthesia prior to administration of other anesthetic agents. It can also be used as a sole anesthetic agent for brief surgical procedures, such as procedures that are less than 15 minutes. Supplement to regional anesthesia or low potency anesthetic agents such as nitrous oxide, providing hypnosis during balanced anesthesia with other drugs. Control of convulsive conditions during or following inhalation anesthesia, local anesthesia or other causes, in psychiatry, narcoanalysis, and electroconvulsive treatment. What are the absolute contraindications of Thiopentone? Status asthmaticus. If you remember here, we talked about bronchoconstriction, right? So would you want a patient to get bronchoconstriction if they're in status asthmaticus? No. So you never, ever administer Thiopentone in a patient that is in status asthmaticus. However, even in asthma, we try to avoid Thiopentone. Then latent or manifest porphyria, then previous hypersensitivity to barbiturates, complete absence of suitable veins, lack of resuscitative equipment, and lack of knowledge of the drug. So if you do not know the drug, you do not know the indications, contraindications, the dosage, do not use the drug. Then what are the relative contraindications? Hypotension or shock, severe cardiovascular disease, severe liver disease, mixed edema. What are the side effects of Thiopentone? Arrhythmias, hypersensitivity reactions such as skin rash, pain on injection, urticaria, angioedema, bronchospasm, laryngospasm, and cardiovascular collapse, hypertension. So what are the advantages of using Thiopentone? Injection of anesthesia is rapid and pleasant. If supplemented, these drugs are suitable for maintenance of anesthesia. Nanosecretion is non-emetic, non-explosive. the reason we're mentioning non-explosive is if you have gone through inhalational anesthesia, when we talk about ether is explosive. So the reason why we have put it here is that the Thiopentale is non-explosive. Disadvantages: it can cause dose-related cardiorespiratory depression. It has got little analgesia. Actually, it even has anti-analgesia, which is basically increasing pain. Poor muscle relaxation, increased danger of laryngospasm, cardiovascular depression, particularly in hypovolemic or debilitated patients. Propofol. So propofol is the most widely used intravenous anesthetic. It can be used for injection or maintenance of anesthesia in adults and children, but it is not commonly used in neonates. Propofol can also be used for sedation during diagnostic procedures and sedation in adults in intensive care. Propofol has some advantage over thiopentane in that it's superior at suppressing the gag reflex, making it an ideal agent for use with laryngeal mask airways. So basically, remember we talked about the percentages. There was 1%, 2.5%, 5%. So with propofol, 1% is 10 milligrams per ml. It's a highly lipid soluble oil that is combined with glycerol, 2.5%, purified egg phosphatate, 1.2%, and soya bean oil, 10% for intravenous administration. So please take note of the content. This glycerol, egg phosphatate, and soya bean oil. It's a white aqueous and isotonic emulsion. Its appearance is similar to that of 2% milk. As the solution that is used to dissolve, it's similar to total parenteral nutrition solutions. So even when you get to theater, you're able to see something that looks like milky white in a syringe. Like this is definitely propofol. It has a pH of 7 and is supplied in 20 ml ampoules with a concentration of 10 milligrams per ml. Mechanism of action is by acting as an agonistic inhibitor neurotransmitter with carbaglycine. Propofol is a short-acting intravenous anesthetic agent with a half-life of 1.8 to 8.3 minutes, which is basically 2 to 8 minutes. Onset of action is 30 to 40 seconds. Propofol is associated with rapid recovery and less hangover effect than other IV anesthetics. It is conjugated in the liver and the inactive metabolites excreted in the kidney. Less than 2% of propofol is excreted unchanged in the urine and feces. Propofol is cleared from the blood flow, which suggests that extrahepatic metabolism and elimination may be occurring in the lungs. Remember, we said the Thiopentale is metabolized in the liver. Propofol is cleared from the blood flow, which suggests that extrahepatic metabolism and elimination may be occurring in the lungs. Dosage is 1 to 2.5 milligrams per kg body weight. This is again gotten from what card was it called? Let me just check. From pocket anesthesia reference card. Okay, because I know that with dosages we have some difference between different textbooks, so I really had to include the reference point. So propofol produces the following actions. In central nervous system, it causes sleep, smooth injection, minimum decrease in cerebral blood flow due to systemic vasodilation, intracranial and intraocular pressure about decrease. Cardiovascular system, there is a fall in blood pressure. This is seen especially in the old hypertensive hypovolemic patient. Respiratory system, it's a potent respiratory antidepressant. Pregnant uterus, it has a little effect on that, however, crosses the placenta, but it can be used for cesarean section. Adverse effects are local pain, which is reduced by injecting 2 ml of 1% lignocaine prior to the propofol. Anaphylactic reactions such as bronchospasms, erythema, hypotension, and then bradycardia. So what are the advantages? Low incidence of post-operative nausea and vomiting. It has some anti-emetic effects. Smooth and rapid injection of anesthesia. It does not sensitize myocardium to catecholamines. Disadvantages: for analgesia. It contains egg, which can cause allergic reaction in some patients. Then there's transient pain at injection site is common, and there are no muscle relaxant properties. Ketamine. So ketamine is a phencyclidine derivative that induces a dissociated state in which the patient is unconscious but may appear to be awake and does not feel pain. So you may notice it's a common question in MCQs where they ask that which drug produces dissociative anesthesia. And also, what is dissociative anesthesia? So the drug that causes dissociative anesthesia is ketamine. And what is dissociative anesthesia? This is whereby there is sedation, amnesia, and immobility. And one thing you need to know is ketamine produces rapid anesthesia and profound analgesia. If you compare this to the previous two drugs, Propofol and Thiopental, we know that they do not produce any analgesia. However, ketamine does. Analgesia and unconsciousness are produced within 30 seconds following IV injection and within 5 to 8 minutes following IM administration. So one thing you also need to take note about ketamine is, remember we're talking about intravenous anesthetics, so Thiopentone, Propofol, ketamine, they can all be given IV, right? However, ketamine can also be administered IM. The drug is lipophilic and enters the brain very quickly. Injection of anesthesia is accomplished with IV dosage of 0.5 to 2 milligrams per kg. Indications: injection agent for general anesthesia, sole anesthetic agent for short diagnostic and surgical procedures, especially in children and elderly adults. Procedures in which control of the airway is difficult, especially for correction of burn scars of the neck, which render extension and intubation difficult or impossible. Effects are ketamine stimulates central sympathetic outflow, causing stimulation of the heart with increased blood pressure and cardiac output. So if we take note and compare this with the previous, which is propofol and thiopental, you will realize that the other two depress the cardiorespiratory system. However, this one, it's going to do what? It's going to cause stimulation of the heart. It's going to lead to increased blood pressure and cardiac output. It is also a potent bronchodilator, therefore it's beneficial in patients with hypovolemic or cardiogenic shock and in asthmatics. Contraindications are intraocular surgery. It leads to increased intracranial pressure, so you should not be using it in patients that have got increased intracranial pressure or psychiatric problems. Since remember we said that it increases sympathetic outflow, so that leads to stimulation of the heart with increased blood pressure. So you do not use it in hypertensive patients. Then you do not use it in stroke patients or patients that have had a CVA. It's not widely used because it increases cerebral blood flow and may induce hallucinations, nightmares, and other transient psychotic effects, particularly in young adults. However, ketamine may be used illicitly since it causes a dreamlike state and hallucinations similar to phencyclidine. If you know a little bit of psychiatry, you might remember that phencyclidine is one of the drugs of abuse. Side effects can be reduced to a benzodiazepine such as diazepam or midazolam. So advantages of ketamine include the solution is not irritating to veins or tissues, leads to profound analgesia, laryngeal and pharyngeal reflexes may be obtained, muscle tone is preserved. Disadvantages: heart rate, BP, and intraocular pressure are increased. However, if you look at it from another angle, this might actually be an advantage. In patients that are hypovolemic with low BP, this may be an advantage, but currently here is a disadvantage. Diplopia, eye movements, and nystagmus may occur. Confused states with unpleasant dreams and frightening or upsetting hallucinations may occur in adults during the recovery period. And another disadvantage is that there is no antagonist. Then etomidate. Mechanism of action. It acts on the GABA receptors in the reticular formation, leads to rapid onset and recovery. Effects are hypnotic effects, reduce intracranial pressure, anticonvulsant effects, little to no effect on the cardiovascular system, little to no effect on respiration, no analgesic or muscle relaxant effect. So one thing you need to know is if a patient has got a cardiovascular problem, this is the best drug to use, Etomidate. So the side effects include transient acute adrenal insufficiency due to adrenal cortex suppression, which leads to reduced cortisol production, postoperative nausea and vomiting, painful injection, which is avoided by administering an opioid prior to injection, myoclonus. Indications are anesthesia for patients with hemodynamic instability. So, in summary, intravenous anesthetics are a group of fast-acting compounds that are used to induce a state of impaired awareness or complete sedation. So, the commonly used intravenous anesthetics include propofol, etomidate, ketamine, and barbiturates, Thiopentone. So, propofol is the standard drug for induction of anesthesia, and etomidate is most commonly used in cases of hemodynamic instability. Ketamine plays a key role in emergency medicine because of its strong dissociative, sympathomimetic, and analgesic effects. The barbiturate Thiopentale reduces intracranial pressure, making it useful in patients with high intracranial pressure and or head trauma. While the characteristics and side effects of IV anesthetics are highly dependent on the substance involved, they all share a strong hypnotic effect. So this is basically a summary diagram that talks about characteristics, side effects, contraindications, and uses. You can go through this in your own time. This is another summary diagram. These are my references. So basically that's all about intravenous anesthetics. If you like the video, please like, subscribe, and comment. And if you want to watch a summary video, I'll include the link so that you can also go through that. Thank you very much.